Well, parenting is already hard, but once you add a global pandemic, a lot of things can change. Luckily, you're not alone as we face these challenging times. Here to talk with us about the best for your kids and what's best for your kids during a pandemic is Dr. Mary Martin with Pediatric Associates in EASLEY. Doctor, thank you so much for being with us this morning.
Thank you.
Now, the first questions, we do want to talk about the masks. I know a lot of parents have been asking about that and exactly what type of mask is best for children and if there's a difference based on age group.
You know, I always tell my patients the best mask best mask for their child is the one that the child's gonna wear. So it's a good idea, you know, to start thinking like, what kind of things do my kids like? You know, pick fun designs and colors. But when we look at the science of it, we really want to make sure that the mask fits them well, that it protects them. The World Health Organization recommends 3 layers for a cloth mask. So you want to make sure you actually look for a child-sized mask. You know, a younger school-age child is not going to fit into an adult-sized mask. That's not going to protect them. So you really want to make sure it fits well on their face.
All right, yeah. So the number one priority is making sure that it fits. Now, we do know that there's a number of different symptoms around COVID-19, and it's hard to kind of, pinpoint exactly how that would look in children. What are some symptoms you want to watch out for in children and teenagers?
So in pediatrics, the symptoms that we've been seeing the most are a headache, a fever, body aches. A lot of times we see gastrointestinal symptoms like vomiting, diarrhea, nausea. And then, of course, we'll also see some cough and congestion. But I think the fever, headache, body aches, those are the more common things we've been seeing.
All right, so watching out for those. Let's say your child is sick. What's the best option here? Would a virtual visit be the first step, or is an in-person visit at a pediatrician going to be the best option?
Yeah, so virtual visits are awesome. You know, they're great ways to do follow-ups and things, but there's some things you can't do virtually. I can't look at your child's ears. I can't listen to their lungs. And if your child's really not able to communicate, you know, like in a younger child or even a child with special needs, it's really best to have them checked out in person. You know, we're taking lots of precautions to keep your child safe so that we can still see them in the office even with COVID. We're in PPE. And so, you know, don't be afraid to bring them in if they are sick and you want to get them checked out. But, you know, the best way to find out is either call your pediatrician or you can send a MyChart message, like which is sort of like an email message, and find out, you know, what would y'all recommend? Should I bring them in or should I do a virtual visit?
Absolutely. And of course, we know parents are going to be keeping a close eye out for those symptoms and really kind of weighing their options here. We want to talk about flu shots really quick because we know they're important every year. Will the flu shot be more important this year? What would you tell parents that have never gotten one for their children before?
Yeah, I think it's actually even more important this year. There's a lot of the same symptoms with COVID and with the influenza. And so if we can prevent influenza or reduce the severity, you know, it's one, going to keep your kid in school, going to keep them healthy and reduce secondary complications, but also it's going to help because if they have those other symptoms, we know for COVID versus thinking for sure it's the flu. And yeah, if you've never got a flu vaccine for yourself or your child, this is a great year to start. You know, it's not too early to start thinking about the new ways that you're protecting your kid. You know, you're sending them in a mask this year. We're being extra cautious, you know, add in that extra level of protection with the flu vaccine.
Absolutely. Just hoping some parents are able to take that advice this morning. Dr. Mary Martin with Pediatric Associates in EASLEY, thank you so much for being with us this morning.